Welcome to our weekly broadcast of the African Treasures. Here we bring to you African arts, culture, and music. We also discuss issues of concern to people of the African descent in America, the Caribbean, South America, Africa, and all over the world. We invite you to come and see Africa in a positive light. So stay tuned and tell your friends to do the same.
Welcome to another episode of the African Treasures. I'm Dr. Okeke, your host. Medical issues will be the focus of our show today. And the first segment, we're going to deal with sleep apnea. And in the following segment, we're going to look at the tightening of the facial skin to reduce the effect of aging. And my guest today is a specialist in the field of otolaryngology, and she's Lisa Perry-Gilks. Welcome to the show.
Thank you, Dr. Okeke. It's a pleasure to be here today.
Okay, welcome. You're board certified in the field of otolaryngology.
Yes, sir.
Can you please, for the benefit of our viewers, explain what otolaryngology is and what an otolaryngologist does?
Otolaryngologists are the physicians that care for disorders of the ear, nose, and throat, medical and surgical. In our training, we also get training in facial plastics and reconstructive surgery. And some of us get training in allergy, but we treat patients from cradle to grave. A lot of people think of us as the ones that take out the tonsils or put in what they call tubes in children, but sinus diseases, allergies, and cosmetic procedures we do.
You talk about reconstructing the face.
Right. If some person unfortunately has automobile accident or some sort of trauma or some sort of tumor that requires removal of that, we can rebuild the bony structure and the functional soft tissue.
Yeah, when you talk about ear, nose, and throat, that makes me think of sleep apnea.
We do. That's something we treat.
Can you please help explain to our viewers what sleep apnea is, in case for people who are not familiar with it?
There's a large amount of the population that suffers from sleep apnea. The only thing is that they think they're just snoring. They said it's usually not the patient that suffers, it's the family members that suffer.
So actually it's snoring we're talking.
In a sleep apnea.
Okay.
Not everybody that snores has apnea.
All right.
They call it heroic snoring. There's always the anecdote that they talk about the Navy man in the submarine that snored so loud that he set off the sonar. But what happens, and beside the regular sounds that you make when you sleep, your respiration slows down so much that for periods you stop breathing. So what the family members will say is they'll snore, they'll go and hold their breath and then let go with and during that episode, when they stop bleeding, you can develop problems like decreased oxygen in the blood, and that causes things like hypertension, changing in increasing the number of red blood cells. In children, it also causes what we call enuresis, which is bedwetting. What happens is the children's oxygen saturation is so low that they aren't arousable to know that they need to go to the bathroom, so the bladder just empties on their own.
What causes sleep apnea, really?
It's caused by the laxity or any obstruction in the airway that leads down to the trachea. Now, it can be in the nose, it can be in the mouth, it could be lower in the throat and the base of the tongue. When we lay down, most people lay on their back. And when you lay down, the soft tissue in your throat falls back and cuts off the airway.
Wow.
It's kind of like if you think of the wind blowing by a curtain, a heavy curtain, and you hear that. And that's what makes the sound, and it just collapses.
Is it dangerous?
Yes, it is.
What are the dangers?
Untreated sleep apnea causes what we call daytime hypersomnolence. You're sleepy all during the day. You don't get efficient rest. You don't get REM sleep. So your sleeping is not effective. You have decreased concentration, and you may be moody. It causes what we call congestive heart failure. It causes pulmonary hypertension. The pressure that it takes for the lungs to work appropriately is increased, and in some cases it can cause impotence.
Impotence?
Yes, sir.
Now, let's get back to the snoring. Snoring can be a little bit unromantic.
Yes, sir.
And it can hurt a lot of, it can hurt romance, and it can hurt relationships.
It can, and that's funny that you bring that up, because a lot of the patients with sleep apnea don't think they have a problem. What happens is the spouse, be it male or female, because women do snore even though we say we don't, will come in, bring the patient in. And I had one patient that was hilarious. The wife came in for sleep apnea, and she turned around and he said, well, he snores too. And he told her, I do not. She said, yes, you do. He said, I do not wake up the dog, so I don't snore. But he was actually worse than she was.
Well, since this is such an uncomfortable situation for relationships and also for health, how do you recommend, how do you treat sleep apnea?
Well, the first thing you have to do is we have to gauge your severity. Do you just suffer from snoring, or do you have true sleep apnea?
Okay.
So you have to go, and we have to order a polysomnogram. That's where you go to the sleep lab, you take your PJs, and they monitor your breathing, they monitor your brain waves, they monitor your heart with the EKG, so you get, they also monitor the oxygen saturation in your blood. They monitor your limbs, because what's coming prominent now is restless leg syndrome, so they tell if they have that. And they count exactly how many times you stop breathing a night and for how long you do it. I have patients that stop 100 times a night, which is really awful.
Does it require surgery sometimes for treatment?
There are multiple ways to treat it. The non-surgical way is using what we call CPAP, is continuous positive airway pressure machine, or BiPAP. A lot of patients don't tolerate that well, so we have to move on to surgical modalities. And what you do then is you evaluate the patient, and you find where the site of obstruction is. It may be in the nose, it may be in the throat, and it may be lower down at the base of the tongue.
Does obesity contribute to this at all?
Yes, it does. What happens is, besides just the weight on the soft tissues, which is interesting to find out, if you think about expensive steak and how the expensive steak is modeled and has the fat in, the fat actually will get in between the different muscle layers and cause it to collapse.
So the people who are obese are at more risk?
Yes, they are.
Oh, okay. Well,
but that doesn't mean thin people can't have it too.
All right. Well, please hold your seats, and we are going to be back with Dr. Lisa Perry-Gilkes, an otolaryngologist. Thank you.
We are bringing the treasures of Africa from all parts of the world straight to you.
The Law Office of Donald P. Edwards is proud to sponsor African Treasures, a program that celebrates the African continent, its people, its music, its past and its future. Wherever we are on the face of the earth, we are an African people.
Welcome again to African Treasures. If you missed this show, please log on our website. It's www.africantreasurestv.com. You have a chance to view all the shows that we've done over the years. Again, the focus of our show today is otolaryngology, and my guest is Lisa Perry-Gilkes. Welcome to the show.
Thank you, Dr. Okeke.
I didn't get a chance to compliment you on your beautiful African outfit.
Well, I thank you.
That looks very lovely.
I thank you. I'm glad to have this opportunity to wear it because it's African celebration.
Thank you, thank you, thank you. In the first segment, we were looking at sleep apnea and some other areas of ear, nose, and throat problem.
No.
But I want to move away from that a little bit, and because people who want to know more about it can call your office.
Certainly, they're welcome to.
Especially those who are in danger of losing their relationship because of snoring.
Absolutely.
We have Dr. Jilks here to help us. I want to look at this thermage.
Yes, sir.
Can you tell us a little bit about thermage?
I'd love to. Thermage is not as new as we think it is, but it's getting more well known as what we call a non-surgical facelift. But recently we've been approved by FDA to do body work, to move off of the face. So it's a mechanism by which to harness the strength and the capacity of the body to tighten the skin.
In other words, this is a process of reducing the aging process in the face.
Right, reducing the laxity in the face, arms, and tummy.
In other words, saggy skin can be tightened.
Yes, it can.
That's the process.
Absolutely. And what it does is it stimulates the body to tighten it itself.
Okay. Now, how do you do this?
It is performed with radio frequency. What happens is we have a probe that has multiple functions. The initial function is it cools the skin off, and then it gives a radio frequency pulse to a level lower than what we call the dermis. The dermis is the skin. Completely below the dermis is a collagen level.
Yes.
It stimulates the collagen to tighten up.
Okay. So, is this an alternative to plastic surgery?
It is.
To reduce all those.
Now, what it
does
is reduces impressions, but if you really need, if your laxity has gotten to a specific point, no matter how much we tighten the collagen, it can only do so much. Okay. It's more for people that want a refreshing. It's, if you're not quite ready for an extreme makeover, okay, we can refreshen you and we can prolong the time before you may need a major procedure.
So actually, it's something that you can deal with until it gets to the point where you need extreme measures, like measures, like you go under the knife.
Right, and what it can do, it can possibly prevent you from ever needing the surgical facelift or the more invasive surgical procedures. What it does is it kind of like if you would think about a piece of cotton, and you wet the cotton, and you know when it dries, it kind of draws up.
Yeah.
It draws the skin up, and what happens is as the skin tightens, it lifts all the areas. All these, like this little spot right here, this will pull up really nicely.
Is this something you do every so often, or you do it once and you're tightened and that's it?
After you have it done, you see the maximum effect in 6 months.
Okay.
And it usually lasts for a couple of years.
Okay.
As opposed to the traditional surgical procedures, this is an office procedure.
Okay.
It requires no general anesthesia. Sometimes people might want something to relax themselves, but I do need the input from the patient to tell me exactly how they feel. The majority of these procedures I've done with nothing but what we call vocal cane, is it talking to the patient, reassuring the patient, and just, you know, getting them to relax.
Okay. Well, this is very exciting. Knowing that somebody can get facial treatment or treat the skin, the saggy skin on the face without going on the knife.
Right.
Now, let's hold that thought.
Okay.
Because we're going to take a little station break.
All right.
And we're going to view some of the videos that help explain what you're talking about. And we shall be right back.
I've been very, very pleased with the results.
I liked when I was looking in the mirror and I looked better to myself.
I love it. Want to do it again?
The Thermage skin tightening and contouring procedure represents a breakthrough in the pursuit of a safe, non-invasive procedure for improving aging skin. Thermage is the one treatment that produces beautiful, natural-looking tighter skin renewed facial contours, and healthier collagen. Thermage uses a patented radio frequency technology that has been clinically proven to safely tighten and gently lift and contour skin. This incision-free procedure is fast and easy and requires no downtime. It is a safer and less expensive alternative to invasive cosmetic procedures. The result is immediately smoother, firmer, tighter skin that improves over time.
There was a lift that was noticeable, but the biggest thing for me was to feel that there was more firmness.
The quality of the skin is better. It seems thicker, a little bit smoother.
I noticed that my face was rounder and tighter.
The skin is made up of two layers, the visible outer layer, called the epidermis, and a deeper layer called the dermis. The main structural component of the dermis is a protein called collagen, which is the key to healthier, younger-looking skin. Age, genetics, sun exposure, and other factors contribute to a gradual breakdown of collagen, which results in visible signs of aging, such as wrinkles and skin laxity. With the touch of a sophisticated thermotip, radio frequency energy is delivered to the deep layers of your skin, causing the collagen to heat, while the outer skin layer is always protected by cooling. This heating creates an immediate contraction of the existing collagen, followed by the formation of new, tighter collagen over time. The result is visibly tighter skin with a natural-looking improvement in tone, contour, and texture. And Thermage is the ideal option for all skin types. The Thermage procedure causes the contours of the face to change and the skin to tighten, including the area around the eyes, crow's feet, forehead and brow, jowls, nasolabial folds, jawline, and chin.
For over 10 years now, the Metro Ebony Pages has been the only directory that caters to the minority communities in Metro Atlanta. For businesses trying to reach the minority communities, the Metro Ebony Pages is your vehicle. Individuals and families looking for services within the community, look first in the Ebony Pages. You may reach us at 404-209-8654.
Welcome again to African Treasures. I hope you've been enjoying all the medical education we've been getting from Dr. Jilks. Let me please use this opportunity to let our viewers know that African Treasures is not just for a section of people in Africa. This is your show. If you're African American, if you are African, if you're from South America, if you're Caribbean, this is opportunity for you to come and express yourself. Help us know more about your country, your tribe, your culture, things going on in your business. We need to know about it. And this is viewed not just by Africans, but by people of African descent. And having said that, we get right back into our topic. Welcome again.
Thank you.
Right. In the last segment, we're talking about the treatment of the facial skin.
You know, you brought up African Treasures, and what's nice to know about Thermage, the radio frequency tightening, is it's colorblind. It doesn't matter how much pigment or how little pigment that you have, because it functions on the level of the collagen, which is below the dermis. A lot of times with laser procedures and laser tightening, you have to have a specific laser for your pigmentation, and initially the lasers were not produced for our people. I've actually had a family member say that she wanted like laser hair removal, and she has moderate pigment. The physician told her that she needed to have bleaching cream to bleach her skin. And she said, "No, thank you."
Actually, I was going to ask you if how this relates to people of African descent, people of dark skin color. But I'm glad you already addressed that. What I want to ask you next is, how does this differ from Botox and fillers?
Okay. What this does is it works directly on the collagen. Botox is actually botulism toxin. It's medical grade. It's not the one that
you inject something into the body.
But what it does is it works at the nerve endings to prohibit them from causing stimulus to the muscle. Okay, so Botox works on the lines that are like the frown lines, but it doesn't help with sagging. Now, if you have a lot of straight lines across your face and around your eyes, Botox can treat that. They complement each other.
You can have Botox and still have...
you can have Botox and you can have Thermage. Since Botox is a protein, you like to do the Thermage first because you don't want to, what we call denature or kill the effects of the protein. But you can even do it at the same sitting. The fillings are fillers like Restylane and the other fillers that are available. Radiance is one. Help. They're like pumping little jelly or fillers into a defect. If you have like an acne scar or a scar from chickenpox, you can just kind of fill that up and even that out. Again, all these procedures complement each other. They don't do the same thing.
Well, what I was going to ask you is, are these things very expensive? I mean, I'm not expecting you to tell me the exact cost because it's difficult to do on air here. But how expensive? How affordable?
Well, in actuality,
it looks like everybody needs it. Over the age of 40 or 50, you know.
And that's the perfect age to have these things done.
Oh, okay.
And not to say that either one of us have reached that point.
I was going to ask you that. All right. No, we're not saying that.
But the Thermage procedures are approximately half the price of the surgical procedures.
Half the price?
Right. And you don't have to worry about any anesthetic use. There's no extra cost charge like the hospital charges. For major cosmetic plastic surgery, you'll either go to a surgery center and you'll have to have some sort of sedation or something like that. Well, that's not needed. So that cuts that cuts the cost.
How does it compare with the cost of Botox?
Botox is charged by the unit. So depending on how many areas that you want to treat, Botox can vary. Botox is usually less than Thermage.
Or it costs less.
Right. But Botox only treats wrinkles. It won't lift your face. It won't help with the little sagging thing going on there.
How old can a patient be before he or she seeks to go for Thermage? How young?
Of course, you want to be an adult. The target area that they say is you can start as young as your 30s. I mean, it really depends on the laxity of skin.
But you know, some people, after they've lost a lot of weight, have saggy skin.
Right.
You know, either bags under the arms or
this will help
right here under the chin and stuff like that.
That will help.
Even though they are still under 30.
Yes, that'll help.
Okay, this is recommended too.
Yes.
Okay. Do you? This is performed in your office?
Yes, sir.
Okay.
So that saves another charge.
Right. And where's your office located anyway?
My office is in East Point on Cleveland Avenue, 1136 Cleveland Avenue, Suite 621.
Okay, very close to the South Fulton Hospital.
On the same property.
On the same property?
Yes.
Okay. Well, Dr. Jilks, I want to thank you for coming to the show.
Oh, thank you for inviting me,
And
Dr.
we're going to
Okeke.
take a little break and watch some of the clips from the Thermage treatment.
Thank you.
And please come back and see us.
Oh, I will.
All right. And thank you for watching, and thank you for allowing us to come into your home with this wonderful message. And keep on watching. Thank you.
The Thermage procedure is a completely non-invasive, safe treatment that is performed only in a doctor's office. Depending on the size of the area to be treated, the procedure may take as little as 20 minutes or up to 2 hours. The thermotip delivers the radio frequency energy to the dermis. Each time an energy pulse is delivered, you will experience a brief heat sensation. This indicates that the Thermage treatment is working to tighten and stimulate your existing collagen. To protect your skin and make the treatment more comfortable, the top of the skin is cooled before, during, and after each application of the energy. Your feedback on the level of heat sensation you are experiencing during the procedure will help guide your doctor in applying the treatment most effectively.
0 to 4 scale.
1.5, 2.
It was this slight tingly, sort of prickly feeling as the wand was moved across my face, but definitely no discomfort.
Treatment with Thermage should be comfortable and requires no anesthesia or sedation. Your doctor may offer light pain medications prior to treatment to minimize sensation. Patients can immediately resume normal activities, and there is no special care after treatment. Good skin care and sunscreens are recommended as part of your regular skincare regimen. The only signs of treatment are naturally smoother, younger, and healthier skin.
I could do this treatment in the doctor's office and go back to work the next day.
Planted my shrubs the next day and went to the supermarket and even went to the gym.
I had a lot of people tell me that I looked better. They were trying to find out, did I have new glasses?
I had a couple of friends say to me, wow, did you lose weight? Or you look different. Did you cut your hair?
It's a very natural result, and nobody's really noticed that I had anything done, but I've had a lot of compliments.
Thermage is the most advanced way to tighten skin and renew facial contouring without downtime. An affordable, non-invasive procedure, Thermage represents a new advance in modern treatments aimed at reversing the aging process. This unique procedure is available only in the offices of qualified physicians. Consult your doctor to find out how you might benefit from the Thermage procedure. Thermage, for smoother, more beautiful, and naturally younger-looking skin.
I felt good when people said I looked good. My face looks younger. I don't have any side effects.
People tell me, wow, you look great. For your age, you look great. So it's been a pleasant experience, definitely.
I would definitely recommend Thermage to anybody as a good result, painless procedure, no downtime. Wonderful.
For watching, and please join us again next week at the same time as we continue to share with you the treasures of Africa.